Hi, I'm Dr. Kathy Anderson, and I'm the Interim Director of the Student Health Center at Sonoma State University. Welcome to Sonoma State. I want to give you a little overview of the services that we provide for students. Um, Much of the information I'm going to give you, you'll find on our website or on the patient portal, and I'll review how you access that information during this brief presentation. If you do have questions after you listen to my presentations today, please don't hesitate to call the Student Health Center. We are open all summer and happy to answer any questions that you have. Our contact information will be on the website and I'll point that out. So let's start by, I'm going to try to share my screen with you here and show you what our website looks like, and also the patient portal, because I think that'll really give you a lot of information. So let's share here. Okay, so we're going to start by, I'm going to show you what our website looks like. Get to my, here we go. All right, so this is our website. Our address is very simple, health.sonoma.edu. So that's up here at the top. Our phone number is right at the top, easy to access. As you look down our webpage, this green box is not usually present, but because of COVID-19, we have had to modify how students access the Student Health Center. In the past, you could just walk in and ask a question or schedule an appointment, or if you had an urgent need. But trying to keep everybody healthy and minimize transmission of the virus has, again, altered how we deal with students. And so now we have everybody call first. If you have a question, if you have, or you want to schedule an appointment, please just give us a call. And again, our number is 707-664-2921. Our clinic is open. It's been open all along. We have never closed during COVID, other than, of course, on the weekends and evenings. And we're going to be open all summer. Our summer hours are a little bit shorter. We're open 8 to 5 during the academic year. We're open 8 to 4:30 during the summer. So this information is, again, just for the current time. I want to point out this red button. It's called My Health Portal. This is one way you can access the health portal. And this is like portals that most insurance companies use and now other doctors' offices use. It is a very secure way for us to communicate with you and vice versa. And so when you click on that button, it takes you to the portal. First, you'll have to sign in again with your SSU ID. And then I'm going to use myself as an example here and show you what happens when you get into the portal. And here it is. This is my home page. Over on the left, there's a menu that gives you opportunities to explore a lot of different functions of the portal. You can update your profile information, which has your email address, phone numbers that we can reach you with, that sort of information. Medical clearances is a key area because if you click on medical clearances, I don't have anything that, and I can't really upload information to the portal like you'll be able to, but this is where you will upload documents like your immunization records, which are required for required for attendance at Sonoma State, and it's a way for you to communicate with us by uploading information. You can enter in your own health history, and any information that you enter here as a patient will show up in your actual electronic record chart, but it'll be in red until one of the providers, and we'll talk about our providers a little bit later, the providers, the first time you come to see us virtually or in person, we will verify this information with you. So it's nice for you to be able to enter things like names of medications while you have the medication in front of you. So this is really, you can do this now, and this would be a handy thing for you to put in so that the first time we talk to you, we have that information in front of us. When we are allowing appointment scheduling online, which we're not able to do right now, but eventually we'll go back to being able to allow students to schedule appointments yourself. There are certain kinds of appointments that we encourage you to call us about first, but you'll be able to schedule an appointment that works into your school schedule, which is really handy. Students have really responded well to that. And then there are several other ways. Messages is another key tab because we can send you secure messages such as lab results or following up with you about something that you saw one of our providers about. If we send you a secure message, you will get an email in your SSU email box saying you have a secure message, and that should trigger you to come to the portal, click on the messages tab, and the message will be right there. That if you, once you open the message, then we get flagged so we know that you saw our message, and so that's a great way for us to communicate. So watch your SSU email. That's critical, especially as a new student, because the university and us and your professors will all be communicating with you through your sonoma.edu email address. So check it every day, at least once a day over the course of the summer leading up to fall. Letters, forms, these are things, again, things that we generate sometimes at student requests, say a letter to return to class or something of that sort. If we're sending you that letter, it'll show up here. There's something here called account summary. We don't yet have a mechanism for students to pay for services through the portal, but that's coming. Believe me, we're figuring that out. Very importantly down here, immunizations. Once you have submitted your immunization records to Sonoma State, they are verified by medical staff to make sure you have met all the requirements, and those immunizations are then recorded in your electronic health record chart, and they also then roll over into the university's system, not the actual immunization, but the fact that you have fulfilled all the requirements, then that goes into the SSU database. So everybody knows you did what you're supposed to do. So at a glance, that's what the portal looks like. I would try logging in, familiarize yourself with it. You can find it again on our website. You can link directly, or the other place you'll find it is on this desktop. This is where your email is. You have to log in to the Sonoma State Network first, and then this is what will pop up after you log in. And it has all kinds of very important links here. Canvas is the educational academic platform, so your classes in the fall semester will be through Canvas. These are my HR is something that only staff have, so this is my desktop. I do not have a health portal link from my desktop, but you will. There are only a couple of them that are red. The email link button is red, and the My Health Portal button is red. So again, familiarize yourself with that. So let's go back to our website here. So again, you can link that way. And then I just want to mention a few other things on the website. Number one, here's our link to summer services, talks about the hours and what we do during the summer. Coronavirus information is here. We update that regularly. Let's start with appointments. First of all of our appointments for the foreseeable future, really, all of our appointments will start with a telephone appointment or telehealth. You will call us if you need to, you have a question or you want to talk to a provider. You'll call our number. You'll talk to one of our nurses or our medical assistants at the front desk. They will schedule a telephone appointment for you with either one of our doctors or one of our nurse practitioners. And that appointed time, the provider will call you at whatever number you give us, and you'll have a telephone discussion about your symptoms or your questions. Based on that interaction, the provider may suggest one of two things. Either they'll be able to answer your questions via telephone, or it might be more appropriate for you to have a Zoom video conferencing visit. We have, through our system, access to healthcare Zoom, which fulfills all the confidentiality requirements. It's not the free Zoom that all of us can access for games and visits and things like that. It's a special healthcare version of Zoom, which is very secure. So our provider would set up that Zoom meeting with you at whatever time was convenient for you so that you could have a confidential visit with your provider. Or they may recommend that you actually have a face-to-face visit. If you're local here on campus or in the area, then we would set it up for you to come in and see one of our providers here. We are set up to see patients safely so that there's no risk of infection either to you or to our staff. We have lots of PPE. Everybody's heard of that now. It's personal protective equipment for our providers. Every patient, if they don't have a facial covering or mask on, the minute anybody enters our building, there are masks right there for people to put on. We have lots of hand sanitizer. We have all kinds of procedures in place to keep you safe and to keep our staff safe. And so that decision about whether to see you via Zoom or face-to-face will be made between you and your provider. The other option that we will have in the fall is that, let's say you are registered at Sonoma State University, but you live in Southern California or in the East Bay or in some place that's far away, and it would not be realistic for you to come to visit us face to face. All California State University students at any campus have access to any California State University health center. And there's no additional charge for you to see doctors or nurse practitioners at another CSU health center once you've paid your health fee to your home campus. So this might work. It might work like this. Let's say you call us, and you would call us if you need to be seen. If you're in Southern California, don't just call another CSU health center. Call us first. We can verify that you are eligible for services. We would try to help you over the phone, but we may discover that you actually do need to do some lab work or need an x-ray or need to access some care that if you were local, we could do for you here. And since you're not local, we would make arrangements for you to be seen at CSU Fullerton or CSU San Marcos or CSU East Bay or Sac State. And these are all great health centers. We work very collaboratively with them. We will, smooth the way for you to be seen at those health centers. You do not pay anything when you come to see us for basic services, and that's primary care, that's basic lab, basic x-ray. If you wouldn't pay us for that service, you will not have to pay another health center for those services either. So that's a really important distinction. But the first step is always to call your home campus health center. So you would call us, and we would help make sure that everything gets accomplished. Let's talk a little bit about services. We do have appointments for primary care. We can provide immunizations, vaccines. We can do blood tests to see if you're already immune to an illness that you need a vaccination for. We also can do things like testing for strep. We can test you for a urinary tract infection. Those kinds of tests that we do on site, there's no charge for. Your student health fee covers all of our basic services, everything that is we would typically see, including lab studies that we do in our lab. Pharmacy items are not free, but instead they're ridiculously cheap. There is no profit on any of our pharmacy items, and our typical pharmacy prescriptions like antibiotics, birth control pills, things like that are $5 to $10. So they're really, really inexpensive. Any x-rays that we do in-house here, which are just basic x-rays, let's say a chest x-ray if you had a pneumonia or if you injured your wrist and we needed to be sure you didn't have a fracture. That sort of x-ray, there's no charge for, and we do it in our facility. Other things, Pap smears is a lab that needs to be sent out to an outside lab called Quest. We get, again, a very, very low cost for that. Physical exams, whether it's for sports or employment or for some other reason, those are called augmented services. There are charges for those services, but again, they're very, very discounted and very affordable for most students. We would not schedule something for you that was going to cost you money without telling you that up front. And we are working hard to make it so that if you do pay for services with us, that those charges will be tacked on to your SSU bill rather than you paying us directly. Before the pandemic started, you would usually pay us cash, check, debit card, credit card, but we're trying to minimize those sorts of transactions. So I'm working as we speak on getting those charges so that they just automatically flow into your Sonoma State account, but all they say on the bill is student health center charge. It doesn't say why you came in or what you were paying for. If you have questions about that, give us a call. At any rate, these are services that we provide, and then again, most of them are covered under your student health fee. Some other charges, there are nominal fees associated with those that we'll let you know about. A good example of that is summer. During the summer when students come in to see us, nobody pays a health fee during the summer, and you don't have to be registered for summer classes to use the student health center. But there is a charge. It's usually $30 for a visit, including any lab or x-ray. This summer we have discounted that to $20 because we know how difficult a time this is for students financially. We're trying to do things as absolutely low cost as possible. So this summer for a visit, it would be $20, including any lab or x-ray that came along with that. Let's see, I want to make sure. Probably the most common lab test that students request that is not, we're not able to do it in our lab, is for sexually transmitted infection testing like gonorrhea, chlamydia, HIV, and syphilis. We just don't have the very expensive machinery, no student health center does, to perform those lab tests. Instead, we collect the specimens, and most of them are urine tests, some of them are blood, and those specimens are sent to an outside giant lab called Quest. Quest works with student health centers to give us the absolutely lowest cost for those tests that can be had. And so for gonorrhea and chlamydia, for instance, common bacterial infections that are easily cured with simple antibiotics. The problem is those infections often have no symptoms associated with them. Those tests are $20 each when we send them out to Quest. That is a hugely discounted price. If Quest was running those tests on specimens that did not come from a student health center and the patient was paying cash for those tests, they're actually $200 each. And I'm not exaggerating. So when we can't do things for free, we do them as cheaply as we possibly can. So that's just an example of how we can get services either very inexpensively or for free for students. So let's go back to the home page because I just want to go down the list of things that are here. Immunizations. This is very important for incoming students. This is a new list of requirements that's taking effect this fall for students at most CSU health centers. Some campuses are not going to be starting these new requirements until next year, but we and many other campuses are starting them this fall. These are required, and this is from the CSU and SSU as well. So measles, mumps, rubella, and then it tells you how many doses. When it says titer, that's a blood test that shows that a person has immunity, and that's what we're after is, are you immune? Are you, or are you not? And if you're not immune, that you're at risk of contracting one of these infections and passing it to other people without knowing it. And that's why these are so important. Chickenpox, 2 doses or a blood test. History of having had chickenpox disease does not fulfill the requirement. If someone has had the illness, then they would get a blood test to prove that they've had it. Tetanus, diphtheria, and pertussis, which is whooping cough, documentation of at least 1 dose after the age of 7. You really should have a tetanus shot every 10 years, but we want to make sure you've had the version that has whooping cough in it at least once since age 7. Meningitis vaccine, 1 dose on or after age 16 for all students who are 21 or younger when they start at Sonoma State. For students 18 and younger, hepatitis B, and that is a 3-dose series of injections. And then everybody does answer some simple questions about their possible risk for being exposed to tuberculosis. And most students, the answers to those questions will be no, they do not need anything more than that. For students who might answer yes to some of those screening questions, either they were born or have lived or traveled in another country where there is a risk of TB, those students will be dealt with by a nurse who will walk you through how to get either a test to make sure you're not contagious with tuberculosis or get a documented record from your private physician stating that you have perhaps been treated for tuberculosis in the past and therefore you are not at risk of exposing others. So these are the requirements, and then there are some recommended immunizations, but these are not required for you to enroll for classes. These are what are called pre-enrollment compliance deadlines. This is now. Summer before you first enroll at Sonoma State is when you need to submit these immunization records to us, the Student Health Center. You can do that through the portal where I showed you can upload information under the medical compliance tab. Again, your immunization records go to a nurse who will review them. She or he will send you a message, a secure message through the portal saying everything's good to go, everything's fine, you're done, or looks like you're missing this and this, please talk to your doctor at home or call the Student Health Center about getting a shot or getting a blood test done. And they will walk you through, that nurse will walk you through the process so that you are compliant. Now, you will be able to register for your fall classes during your orientation or summer bridge. Don't worry about that. Everybody is able to register for fall, but you will not be able to register for spring semester 2021 unless you have fulfilled all of these requirements. And if you have questions or concerns, please don't hesitate to give the Student Health Center a call. Myself or my staff would be happy to walk you through that. But this is critically important. You must provide documentation through records that everybody has when you've had all your childhood immunizations. Your parents or you probably have everything you need to turn into us. But let's say you can't find those records. Then again, call us. We're happy to help you figure out. We can document that you have immunity through a series of very inexpensive blood tests, and we can help you with that here at the Student Health Center, or help you work with your private provider to get that done. So the immunizations are very important, and that's probably where most of our summer questions come in. So get those done or submit that information as soon as possible, but it will not impact your ability, again, to register for classes this fall. But we've got to get it done before spring semester registration, because at some point in the fall, probably in early October, mid-October, if we will be at a point where students who have not fulfilled this requirement will have a hold placed on their registration, which will not allow you to register for spring semester. And that's a lot of times where students kind of then start calling us and going, oh my gosh, I didn't do this. Now's the time to take care of it, where hopefully you have more time to take care of it. We're here to answer your questions. We'll give you lots of warnings before we put a hold on somebody's account, but don't be that person who ignores those warnings, and then they try to register and they won't be able to. So let us help you get that done. As I'm finishing up, I just want to mention a little bit about SHAC. SHAC is our Student Health Activities Club. They provide advice to the Student Health Center about our services. It's a group of students, it's a club, and it's really a lot of fun. It's students from all majors, not just pre-nursing or biology. It's people who are interested in learning about health issues and want to help students on campus be healthy. That's particularly important right now during a pandemic. And so consider joining SHAC. They are, again, a great group of students. Here's this year's group, and they're just a really energetic group that's very friendly and welcoming, and they can be a great way for you to get involved on campus. One of the projects that SHAC has taken on over the last few years as a stress management tool for students, they have a program. It's called Doggy Play Day. And once every month or two, they work with a local nonprofit group that brings therapy dogs to campus for an afternoon, and they set up out on the quad, and students can come in and just meet the dog and its owner and pet dogs. And it's wonderful, and students love it. We have hundreds of students who come to Doggy Play Days, and the SHAC students staff that and advertise it. And it's just one example of a really fun project that's really, really helpful for Sonoma State students. And there are many other things. We get involved with blood drives and work with other clubs on campus that are also health oriented, and really provide a wonderful service to the campus. But they also help us do a better job for students, and again, advising us on how we can do a better job of serving Sonoma State students. So I think that's kind of a good overview of the services we provide. Again, the best way to access us for any questions right now is through our phone number, 707-664-2921. We're here 8 to 4:30 during the summer. We're here over the lunch hour. So please give us a call if you have any questions. We're going to reach out to all students, not just incoming students, in early August with an email kind of reminding you that we're here and how to access our services. And but if you have any questions over the summer, please give us a call. So it's very nice speaking with all of you, and my hat's off to all of you who are putting up with the shelter in place and hopefully doing the right thing, taking good care of yourselves. Be safe out there. We are really looking forward to working with all of you starting this fall. And again, welcome to Sonoma State. Take care.